Right now we can start and
Okay.
Kıymetli akademisyen hocalarım, alanda çalışan değerli meslektaşlarım ve sevgili öğrenciler. İzmir Ekonomi Üniversitesi Sağlık Bilimleri Fakültesi olarak yaptığımız webinarlarımıza pandemi döneminde Dünyada Hemşirelik Eğitimi serimizle devam ediyoruz. Hepiniz hoş geldiniz. Bir yılı aşkın süredir dünyayı etkisi altında tutan COVID-19 pandemisi nedeniyle eğitim ve öğretim faaliyetleri de uzaktan devam etmek zorunda kaldı. Bizler de bildiğiniz gibi Türkiye olarak bir yıl önce 23 Mart 2020 tarihinde YÖK'ün aldığı kararlar doğrultusunda online hemşirelik eğitimini başlattık. Üniversitelerin altyapı olanakları ölçüsünde farklı uygulamalar yapıldığını da biliyoruz. Biz de bundan yola çıkarak eğitimin yarıdan fazlası uygulamaya dayalı bir program olan hemşirelik için bu sürecin nasıl işlediğini görmek istedik ve Amerika, Avustralya örneğinin ardından bugün de sizlerle hep birlikte Hindistan hemşirelik eğitim deneyimleri ile konuyu ele almaya devam edeceğiz. Eski webinarlarımızı izleyemeyenler ve izlemek isteyenler Ekonomi Üniversitesi Hemşirelik Bölümü sayfasından ulaşabilirsiniz YouTube kanalı linklerine. Moderatörümüze söz vermeden önce güvenli bir ortamda etkinliğimizi yapabilmemize destek verdiği için İzmir Ekonomi Üniversitesi'ne, bu webinar serisini düzenleyen Tülay Yavan ve Burcu Özkul hocalarıma ve yaptığımız tüm webinarların düzenli bir şekilde sürdürülmesi ve sosyal medya hesaplarından paylaşımını yapan Hemşirelik Bölümünden genç akademisyen arkadaşlarıma çok teşekkür ediyorum. Bugünkü webinarımızın moderatörü İzmir Ekonomi Üniversitesi Sağlık Bilimleri Fakültesi'nin genç öğretim üyesi sevgili Burcu Özkul. Biraz onunla ilgili bilgi vermek istiyorum. 2006 yılında Ordu Atatürk Sağlık Meslek Lisesi'nden mezun olduktan sonra 2014 yılına kadar yetişkin dahiliye ve özellikle de çocuk olmak üzere hematoloji, onkoloji, kalp damar cerrahisi, yoğun bakım gibi özellikli birimlerde hemşire olarak görev yapan Burcu Özkul, bu esnada lisans eğitimine de devam ederek 2012 yılında 9 Eylül Üniversitesi Hemşirelik Fakültesinden mezun oldu. 2014'te aynı fakültede psikiyatri hemşireliği anabilim dalında araştırma görevlisi olarak çalışmaya başladı ve 2016 yılında psikiyatri hemşireliği alanında yüksek lisans eğitimini ikincilikle tamamladı. 2019 yılında da doktora eğitimini bitirdi. Profesör Doktor Hakan Türkçapar'dan bilişsel davranışçı terapi eğitimini aldı. Doktora tezi ile YÖK Yurtdışı Araştırma Bursu kazanarak Mayıs ve Ağustos 2019 tarihleri arasında ziyaretçi araştırmacı olarak Sydney Üniversitesi Beyin ve Zihin Merkezi'nde çalıştı. Doktor Burcu Özkul, psikiyatri hemşireliğinin yanı sıra nörobilim dalında da çalışmaktadır. 2012 yılından bu yana Ege Üniversitesi Tıp Fakültesi bünyesinde yer alan multidisipliner bir araştırma grubu olan SOCET üzerinde birlikte laboratuvarında çalışmakta. 2019 yılında Ege Üniversitesi Sağlık Bilimleri Enstitüsü'nden de sinir bilim yüksek lisans programını da tamamlayıp mezun oldu. Ergenlik dönemi, depresyon, beyin görüntüleme, sosyal destek, koruyucu ruh sağlığı alanlarında araştırmalar yapan Burcu Özkul ile 2020 Ekim ayından itibaren de İzmir Ekonomi Üniversitesi'nde birlikte çalışıyoruz. Ben sözü daha fazla uzatmadan sevgili Burcu'ya bırakırken katılımcılarımızın katılım belgesi alabilmesi için sağ alt köşede göreceğiniz chat balonundan paylaştığımız formu doldurmanızı hatırlatmak istiyorum. Evet Burcu, söz sende.
Tanıtım için çok teşekkür ederim Filiz Hocam. Çok naziksiniz. Ben de yabancı konuklarımızı tanıtmak istiyorum. Bugünkü konuşmacılarımızın da biraz özgeçmişinden bahsetmek istiyorum. Ancak yabancı konuklarımızın da çoğunlukta olması nedeniyle tanıtımları hem Türkçe hem de İngilizce olarak yapacağım. Thank you for the introduction, Filiz Hocam. Since we have foreign guests, I will make the introduction in Turkish and also in English. Öncelikle tüm katılımcılara hoş geldiniz diyorum. Bugünkü konuklarımızı sizlere kısaca tanıtmak istiyorum. Sonrasında da program akışı ile ilgili kısa bir bilgi vereceğim. I welcome all participants. I want to introduce our guest today. Then I will give the information about the program flow. İlk konuşmacımız Profesör Doktor Profesör Suresh Sharma. 2000 yılında Rajiv Gandhi Üniversitesi Sağlık Bilimlerinden hemşirelik eğitimini tamamlamıştır. 2005 yılında National Institute of Nursing Education'da cerrahi hemşireliği yüksek lisans eğitimini tamamlamış. 2010 yılında da Punjab Üniversitesi'nde kamu yönetimi bölümünde doktora eğitimini tamamlamıştır. Doktora sonrasında University of California, Hindistan Hemşirelik Araştırma Derneği doktora sonrası merkezi ve İsviçre Küresel Hemşirelik Liderliği Enstitüsü'nde doktora sonrası araştırmacı olarak çalışmıştır. Profesör Sharma aynı zamanda şu anda All India Institute of Medical Sciences Üniversitesi'nde profesör ve müdür olarak görev yapmaktadır. 2019 yılından bu yana da Perioperatif Hemşirelik Derneği ve Yoğun Bakım Hemşireliği Derneği Başkanı olarak görev yapıyor. 2014-2019 yılları arasında da Hindistan Eğitimli Hemşireler Derneği Uttarakhand Şubesi'nde sekreter olarak çalışmıştır. Profesör Doktor Sharma'nın 100'den fazla makalesi, 50'den fazla kitabı, 40'tan fazla da fonlanmış araştırma projesi bulunmaktadır. 90'dan fazla öğrencinin tez danışmanlığını yürütmüştür. 150 ulusal, 11 uluslararası davetli kongrede davetli konuşmacı olarak konuşmacılık yapmıştır. Birçok uluslararası kongrenin düzenleme komitesinde yer almıştır ve halen birçok dergide editör ve hakem olarak görev yapmaktadır. First speaker today is Professor Dr. Suresh Sharma. Professor Sharma is in 20,000 completed his nursing education at Rajiv Gandhi University of Health Sciences. Then he completed his master's degree education in surgical nursing at the National Institute of Nursing Education in 2005 and his PhD education in the Department of the Public Administration at Punjab University in 2010. After his doctorate, he worked as a postdoctoral researcher at the University of California, postdoctoral fellowship of Nursing Research Society of India, and Switzerland Global Nursing Leadership Institute. Professor Sharma is a professor and principal at the College of Nursing All India Institute of Medical Sciences, and he has been the president of the Society of Perioperative Nursing India and the Society of Critical Care Nursing India since 2019. Between 2014 and 2019, he worked as the secretary of the Trained Nurses Association of India, Uttarakhand branch. He has more than 100 articles, 50 books, and 40 funded research projects. Also, he has been advising more than 90 theses. He gave speeches at 150 national and 11 international congresses. He has been on the organizing committees of many international congresses and works as an editor and referee in many journals. Bugünkü ikinci konuşmacımız da Kalpana Thakur. Kendisi uzman hemşire. 2012 yılında Indraprastha Üniversitesi Hemşirelik bölümünden mezun oldu. 2015 yılında Jamia Hamdard Üniversitesi Psikiyatri Hemşireliği yüksek lisans programını bitirdi. Şu an College of Nursing All India Institute of Medical Science'da doktora eğitimine devam etmekte. 3 yıl nursing hemşirelik eğitimcisi olarak, 1 yılda klinik eğitimci olarak çalışmış. Birçok uluslararası yayını ve uluslararası kongre düzenleme görevi bulunmaktadır. Our second guest today is Kalpana Thakur. Kalpana Thakur graduated from Indraprastha University in 2012 with a degree in nursing. In 2015, she graduated from Jamia Hamdard University Psychiatric Nursing Master's Degree Program. Currently, she is a PhD scholar at College of Nursing All India Institute of Medical Sciences. She worked as a nursing tutor for 3 years and as a clinical instructor for 1 year. She has many international publications and international congress organization duties. Bugün Profesör Doktor Suresh Sharma'nın ardından sunumu Kalpana yapacak. Soruları program sonunda alacağız. Chat'ten yazarak veya mikrofonu açarak sorabilirsiniz. Sunumlar İngilizce olacak ancak sunumlarda hem İngilizce hem de Türkçe yazı mevcut. Buna rağmen anlaşılmayan bir yer olursa da chat'ten yazarsanız ben de elimden geldiğince tercüme etmeye çalışırım. Filiz hocamın dediği gibi katılım belgesi için chat bölümünden paylaşılan linki doldurmanız gerekiyor. First of all, Professor Sharma will make his presentation. Then Kalpana will discuss her experiences through the eyes of the students. Then we will make the questions at the end of the program. You can ask questions by typing in the chat or by opening the microphone. For the participant certificate, you must fill in the link shared in the chat section. Artık sözü Profesör Doktor Suresh Sharma'ya bırakıyorum. Professor Sharma, the floor is yours.
Thank you very much, Prako, and I bring greetings from India, and I'm thankful for the Fleece and Brooke and entire Izmir family who have invited me to speak and talk about the nursing education in world during COVID-19 pandemic and experiences from India. Next.
You can change the slides also.
Yes, I'm doing it. So hello, namaste. I'm Professor Suresh K. Sharma. I'm professor and principal at College of Nursing, Jodhpur, Rajasthan, India. I'm here to give presentation on nursing education during COVID-19 and my experiences at India. Now, if we look, COVID-19 has so far claimed far fewer lives than the worst historical pandemics like the past flus which has happened in pandemics has happened in the past. It is particularly terrifying because it aroused so abruptly and spread exponentially and affected almost every country in the world. As reported by World Health Organization, there has been 106 million, more than 106 million cases, confirmed cases, and more than 2,360,000 million cases, people have died. If you look into the situation in India, more than 11 million cases have been confirmed and around 1,057,756 deaths have been noticed. The coronavirus pandemic has brought the importance of nursing to the public's attention. Now public recognizes nurses for their courage, bravery, commitment, knowledge, resilience, advocacy, and persistence in the face of incredible adversity in the current situations. According to World Health Organization, India is facing a severe shortage of nurses. There are just 107 nurses per 1,000 people in India, according to Ministry of Health data in India. This has less than 43% of WHO recommendations. A minimum of 3 nurses are required for 1,000 people. But commitment, kindness, and compassion of our nurses had made remarkable contribution in these difficult times. After wishing his son briefly on a video call as he cut his cake, the man in white turned to his duties, posted as nursing officer at Trauma Center of the All India Institute of Medical Sciences, Delhi. Now dedicated to COVID-19 patients, he is exposed to the infected patients all day long. Embrace each challenge in your life as an opportunity for self-transformation. Now, issues faced by nurses during COVID-19 pandemic: physical exhaustion and mental stress, shortage of personal protective equipment, shortage of experienced nurses, inadequate quarantine facilities, lack of counseling in distress, and feeling of inadequacy, that is psychological threat. Technology is must now for a new normal. First and foremost, I made students as of my focus during the COVID time. The return to the new normality is redesign, remodel, reconfigure the teaching plans, which is very important. Nursing profession has started to experience a reality of economic uncertainty, fear of infection, challenges of distance education, lack of individual protective equipments at workplaces. High quality teaching strategies and increasing and supporting students in such challenges period can be an appropriate solution. Technology in nursing education, which we can have a hope from, is artificial intelligence. Artificial intelligence used in nursing practice improves efficacies and decreases low volume administrative tasks, allowing nurses more valuable time to spend with patients in care setting. We also can make use of virtual reality. Virtual reality is an entirely imaginary digital experience, providing a realistic recreation of three-dimensional environment, experienced and controlled by the movements of the body. Virtual reality excludes the external, that is real-world environment, and resembles to real-life interactions, and we can make use in nursing education for skill building of our students. Internet of Things also can be used. An IoT-based system is being used in India to transmit critical warning signs to the nurses for expected mothers at high risk for fetal and maternal distress symptoms in rural area of the country. A wearable device alerts nurses via the electronic medical record at the closest hospital, allowing nurses to provide medical assistance to mothers by bringing them to the hospitals to receive timely and critical maternal care. Now, major barriers in using e-learning in nursing is internet cost and poor internet connectivity, lack of skills in information technology, lack of these practical and clinical exposure in existing e-learning platforms, which has a limited scope to teach them clinical skills. You can teach them theory, but clinical skills remains a barrier. What innovations do we require for nursing education? Standardized procedures, bring regimens and protocols, guidelines in writing, which is necessary to follow simulation-based learning, objective structured clinical examination as an evaluation method, nursing leadership, and nurse mentors. Other important requisites: nurses should raise their point of view assertively. For example, if you are not confident in handling ventilator patients, then set up and clearly say this to your leader with an interest to learn and provide services, but refrain from individual responsibility in such scenario. Nurses should, the important requisites continuing, the nurses should be offered choice based on science. For example, during current pandemic, no one was asked for their willingness and there was no choice, which also exaggerate anxiety and fear. How can we manage nursing research during COVID-19 period? In-person data collection, protocols need to be rewritten to IRB, overlaid with protocol changes. Protocol change or modifications depends on how study was being executed. Funders acted swiftly, provide the guidance on proposal submission, and award management and implement allowances that enables the grant personnel to be paid and timelines to be relaxed. Now, if you look into our experiences, a picture is worth 1,000 words. Just a glimpse of activities as a part of nursing education under my leadership at AIM, All India Institute of Medical Sciences, Rishikesh. You can see here simulation we have used in community health nursing. This is the simulated environment we have created like a community health setting. And students, this is a student, these all are students, and he is a mentor here. And these are the actors who have acted like a community setting, and we conducted the examination here or assessment here by creating a simulated community health setting. You also can see here we have used objective structured clinical examination as a method of evaluation for exam. Here these are mannequins, these are task trainers, where student is getting experience in a COVID situation with the maintaining social norms of distancing and use of mask. And we have trained and we have also examined the student, not only OSCE but OSLers. The long cases we have created on scenario based cases, and then students have given their examinations on that. We also have made changes in research protocols, like PG students who had randomized control trials or other studies we converted into systematic review and meta-analysis, and then there was no need of data collection. These studies were done based on the literature which was existing in libraries. Research work related to COVID-19 was taken up by faculty and students. More productive research data generated during this period, and satisfactory learning environment regarding research was created. What is our future plan? We are in process of developing mobile-based training and evaluation application, which will be prepared with two unique features: live training sessions and video-based evaluation. This live training sessions will be for clinical skill learning, and this video-based evaluation is for clinical learning if COVID resurges and comes back. So participants will have to answer 5 objective type questions for critical thinking based on questions, and have to upload their video while performing the same procedures in designated virtual lab. So this is how they can create a video for their written demonstration, send us to evaluate whether they have learned this skill or not. Now you can see here, there's a large number of work which has been published from my lab during COVID pandemic. The clinical nursing guideline for management of patients in COVID-19, which was published as early as in the month of February-March 2020. Novel coronavirus guidelines, outlines on infection prevention and control for healthcare professionals. This was again published in February-March 2020. Vitamin D, a cheap yet effective bullet against coronavirus disease. Are we convinced yet? Who should use the face mask during COVID-19 pandemic? Efficient utilization of nursing manpower during COVID-19 pandemic. Healthcare professionals, preparedness for COVID-19 pandemic. Cross-sectional survey in Northern India. Efficacy of cloth mask, prevention of novel coronavirus, systematic review and meta-analysis. This is largely cited globally paper which has been done. This is again very largely cited. Healthcare workers' workplace readiness during COVID-19 pandemic. Anxiety, depression, and quality of life among front healthcare professionals. Immunization and vaccination of children during COVID-19. Locked inside head injury patterns during this period. Digital health panacea for COVID-19 crisis and impact of COVID-19. Psychological status of pregnant women. So large studies has been published by our lab during this period. Thank you very much. If you have queries, as has been instructed, you can take up those queries at the end. Thank you very much for listening with patiently. Over to you.
Thank you for nice presentation, Professor Suresh. At the end, we will take the questions. So I will give the microphone to Kalpana.
Thank you. Good evening to everyone. First, I would like to express my heartfelt thanks to my professor, Suresh Kumar Sharma sir, and to the Izmir University and the moderator, who has given me the chance to express my opinion over such a relevant topic, where I would share the experience of the students during this COVID-19 and experiences from Indian student perspective per se. So my greetings to everyone, and before I would like to start with saying that students, when they enrolled themselves into this program, they did not anticipate such kind of pandemic, and I think that was a major challenge for the intern students, because they were about to pass and then they suddenly this pandemic happened. And I think India was already in a fragile state in terms of healthcare setup and before COVID, and due to COVID, the things adverse and adversity enhanced, as mentioned by Sharma sir in his presentation, that nurse-patient ratio is already a challenge in Indian scenario. So universities across the country have been closed since mid-March, and even before coronavirus lockdown was imposed. And I think that's probably was a equal shocker for everyone, including the teachers as well as the students. And if we talk about advantages, but I could not see the advantages, although, but I think there is a huge, because there was a huge loss in terms of jobs, lives, and economy of the country. But I think college holidays and the time which students got to spend with the family, and there are certain students who really don't get enough time for study during their academic hours, because I think we have in nursing, curriculum is so vast, and if we go and match up with the clinical, then it becomes difficult for them to have time for self-study. So for such students, I think there was few advantages which they got, and In terms of disadvantages, I think it's a long list. But if I talk about students' perspective, then I think online classes was a major challenge in the beginning, because 50 to 60% only adoption is there, and while in terms of traditional learning, it was 80 to 90%. And in our scenario, where majority of the colleges they prefer, and I think majority of the students they are used to for this traditional learning, it was really difficult. And I think low socioeconomic status of the country as in developing country is another, it was another disadvantage, and poor connectivity and internet connectivity issue was another one. I think this virus is a foreshadow of the students' further life to adjust the online mode of education, because it was, upside down for the students to match up with the sudden change in the technology. Because in the beginning it was difficult, because in the beginning they did not think into that perspective. It was just we all thought that it is just a matter of a month or two and we would enjoy that holiday, and then probably we were locked inside the inside the boundaries, and there was no way out for social gatherings also. So I think soon everybody realized that no, it's really something very serious. And then because students, I think most of the time they're worried about their future, their placements, and all such issues, because approximately I think 1.7 billion learners have been affected by this school university closure in response to pandemic. And it has been advised to continue learning through online and e-learning strategies by government, and assigning different reading assignments, exercises, television broadcast, and so many other things were done to engage the student into learning, and so that there should not be any discontinuation in the learning and things should go in smooth way. But it was in the beginning, it was for everybody was in a dilemma, and how the things should proceed and how we'll handle the technological issues and all. So I think there were certain, these are the student testimonials, because being in PhD scholar at the university, I think we are in a close contact with the undergrad and postgrad students, and they share what they feel and what they go through. And we equally felt the same, because we also had our research methodology lectures and so many things and seminars and presentations. So I think these were the few responses. Students, one of the students said that we don't obtain the same information as we obtain in face-to-face lecture and face-to-face class. And I think because they say that the gesture of the teacher and physical presence of the teacher matters. And the worst thing is when they only upload the class notes and no one forces us to read those notes. And it is impossible to learn practical part until you are not in that role. And for few in the beginning, it seems to be very impossible to learn the clinical skills, which is a major part of nursing, I think. And one of the students said, my education would not be good if my clinical training was missing. And I think majority was worried that how we'll get the placement. And surprisingly, one of the students said me that I'll be recognized by the year in which I passed out. And people will ask me, okay, you passed out in year 2020 or 21, so you might not have that clinical skills, and so on. So these were the some statements which were given by students. And I think major concerns were like practicing the nursing care, which was quite unusual at that time, and then uncertainty and time, definitely, and teaching methodologies was complete. There was a complete shift in the teaching methodology, and that was a challenge as students as well as for teachers, I guess. And the context of confinement and the added difficulties were also there. I think this has become now new normal, as mentioned by Sir just in a last presentation, because earlier we were in a phase 1 and it was a shock for everyone, and now we are in phase 2 and things are getting normalized day by day. And I think as after the government guidelines, students are resuming back in small groups and classes have resumed, I think things are getting a bit normal. So that's, if we want to have this in a positive notion, then I think we need to use this technology very wisely. And I think in terms of using the technology wisely, one can only do this if they have good leadership, and it needs a great mentor. And I think I found my institute and I found myself especially very lucky that we have such a great mentor. And I think under leadership of Professor Suresh Kumar Sharma sir, our institution made certain changes at our nursing college. All the lecture materials were available for the student on website, because I clearly remember that after the initial phase of strict lockdown in the March, he was the one who never I think took off, and he was all the time available in his office, and was looking into the matters to see how things can go smoothly along with all the faculty and all. So I think that's a beauty of a good leader, because he himself was up to date with the technology, and he keep a pace with the things, and that motivate his students also as well, and other faculty also to keep a pace with the things, and to find the innovative ways so that students should not suffer. And I think that's one of the beautiful thing about a good leader. And one I clearly remember, once I went to sir and I said that I'll go with my research work and all the things, and he said me that we'll wait for 10-15 days, but I want you to be ready with the plan B, because even if this doesn't work and things doesn't settle back, so you need to be ready with other plans. So that kind of a strategy I think we all need to have. So our teachers were given training to deal with the latest technology and Zoom classes and all sort of things. College campus were completely, because it is Wi-Fi available all the time. So those who are in campus, they did not have that much difficulty, but those who are not, they faced some of the challenges, and all the measures were taken even to resolve that. Recorded videos were posted on the website online and all those things. And online submission and evaluation of assignments was also done. But one thing was very clear, that there was a big no to the compromise on clinical evaluation on the basis of assignments. For all the subjects, OSCE was performed in small group as soon as the student resumed. And Sir has clearly mentioned that for interns, they definitely need to come back, and in small groups, we'll arrange some sort of osler, as sir mentioned, and the clinical simulation, so that they are hands-on with their skills, and we don't want to compromise on such sort of skill sets, I think. So I think this is just an example I would like to share, the example of an osler. In this, like, complete case history of a patient with cardiac complaint is given, findings of CT is attached with the performer, and then student were given task, like if there will be an bleeding in chest tube, so what are the initial steps which a nurse student or nurse posted into a unit should take, and what are the other priorities which you need to look after. So certain sort of theory assignments along with clinical assessments. I hope that I'm able to show this or play this video. Because in this video, it's in Hindi, because most of our patients here speaks their native language. And in this, the two videos which I have shown and displayed, it is just a simulation of mental health nursing, where a student nurse trying to interact with the patient. One is manic and one is a little paranoid, and PG students, scholars, they enacted into the role play to make the things more clear to the students, so that we see how well they maintain their interaction, and what are the flaws into the interaction, how we can improvise the things and provide further instruction to the students. So certain sorts of things were arranged and for students, for their good learning. And I think these are the other things which add on to the learning of the students, as like social classes or online lecture or training on social distancing, hand hygiene, put on and take off of PPE, and airway management of client during COVID, and other crucial steps which were taken at the institute. It were like all the students were vaccinated, strict follow-up on social distancing norms in campus as well as in hostel. Interns were posted in non-COVID clinical areas, and initially into the non-COVID areas, and then as soon as they finished their final exams and all, they have resumed their duties as normal. Students have started in campus classes in small groups, and students were also motivated by mentors to have small groups and do video discussions over the things, and all the tutors were and faculty were all the time available to address any queries of the students. And I think the COVID has left some positive impact for students if you look into deeper perspective, because students are now more eager for their clinical learning, and because we want to go to clinical to see how things happens clinically. But I think professors have also become more efficient and more quick in technology, because nowadays they all are available all the time, and as soon as you put on the message on social media, or you mail them, they instantly reply your queries, and such sort of, I think, change has happened only with this use of technology. And we cannot deny one thing, that the world is immersed with technology, and in nursing education we need to continue with that. And technology as a telehealth care is utilized to get the maximum out of it, and I think outcome in terms of patient care is also great. I think the process of this new change can become easy with the following. First, reader head initiative can really bring a change, because if I'm thorough with what kind of a lecture I'm going to attend, whether it is online or in a small group online on any website, so I'm clear with what I'm going to learn, and then I can have my Q&A from the professors. And one of the interesting thing is, because of this COVID, we got a chance to learn from senior professors, which were really busy earlier, and I think that's another advantage. And time management definitely is a key in this online system, and small online groups for the study. And last, I think we need to ask for help whenever in need, and we need to maintain social life as well along with this. And I think that's all. There will be, I think, challenges that lie ahead, and if I go with what my professor says, he says, but we are ready for it, because we don't know that we might have such situation in future. So I think which is there and going practice, it should be there along with the theory. Thank you so much.
Thank you for nice presentation, Kalpana. I think you can't open the video, so if it's okay for you, can I try it? Maybe I can open it.
Sure. If you can open it, then that would be, I think, good.
I think it cannot open my screen also.
Oh, that's okay.
Okay, thank you. Do you have any questions, our participants? Bir sorunuz varsa alabiliriz. Chat'te şu ana kadar yazılan bir soru görmedim.
Merhaba Burcu.
Merhaba hocam.
Öncelikle değerli konuşmacılarımıza bizimle deneyimlerini paylaştıkları için çok teşekkür ediyorum. Benim iki sorum olacak. İnternlerin uygulamaya çıktıklarını söyledi, COVID olmayan kliniklerde. İntern dışındaki işte 1, 2, 3. sınıflar uygulamaya çıktı mı? O OSCE sınavlarını uygulamaya çıkan öğrencilere mi yaptılar? O süreci biraz daha açıklayabilir mi? Çok teşekkür ediyorum.
Teşekkürler hocam.
Burcu, bu arada ben de Özgür Hoca'nın sorusuna hemen ekleme yapayım, ayrı ayrı sormamış olalım. Ben de şeyi soracağım, hiç klinik deneyimi olmayan öğrencilerle bu klinik uygulamaları nasıl yürüttüler?
Tamam hocam. Kalpana and Professor Sharma, our participants ask, you said your intern go to the clinics without the COVID patients, and they did their clinical practice in hospitals. But what about our other students, other classes, like first class or second class or third class of the students? What about them? They do to their clinical practice in this COVID pandemic, or did you do your clinical practice online? What about the other classes?
What we did is we started when the students went home, then we started their online classes to teach them theory, share the videos of clinical practices with them. Then after some time, we brought them back to hostel. And then we have a state-of-art facility of skill labs. In skill labs, we categorize the things so that they can have hands-on practice, hands-on learning and hands-on practice in our skill labs. For first year, second year, and third year, we did the first arrangement is this. Subsequently, we also brought them into clinical area so that they can do level 2 skill demonstrations on real patients in non-COVID area with all the precautions. Once we were sure that the minimum desired skills they have learned, we examined them and we promoted them to next year. That's the protocol we have followed.
So actually, all of your students go to the clinical practice.
Yes, we have not spared that because they are going to be future nurses. And if we do not assure that they are clinically competent, they have minimum competencies, certifying them as a nurse could be risky for people. So at our center, we assure this. But yes, okay. large amount of skills are trained in our skill labs through video demonstrations of skills, through practicing skills in skill lab, and then certain amount of time in the real patient scenarios.
Did your clinical skills lab is face-to-face?
Yes, they were face-to-face in a small group with all social distancing norms.
Okay, thank you. Tülay Hocam, Nihal Hocam, çevirmemi ister misiniz yoksa? Yani tüm öğrencileri stajı
Benim için gerek yok Burcu ama öğrenci arkadaşlar var. Dilersen onlar için çevirebilirsin.
Tamam
Teşekkür
hocam.
ederim ayrıyeten.
Rica ederim hocam. Tüm öğrencileri 1. 2. ve 3. sınıfları da uygulamaya çıkarmışlar ama öncelikle bir protokol izlediklerinden bahsetti Profesör Sharma. Öncelikli olarak onlara online dersler vermişler. Teorik dersleri verdikten sonra klinik uygulamalarını laboratuvarda yüz yüze küçük gruplar halinde sosyal mesafe önlemlerini alarak yapmışlar. Sonrasında onları sınav yapıp yeterli beceriye sahip olduklarını düşündükleri zaman da hastaneye çıkarıp gerçek hastalarla uygulama yapmalarını sağlamışlar. Bu şekilde tüm öğrencilerini hastaneye çıkardıklarını ifade etti. We have another question. When did the vaccination start for the students? You said all of the students vaccinated.
They are already vaccinated. All the students are vaccinated.
When did they vaccinated?
They have been vaccinated in month of February and March.
This in Izmir.
Yes.
Okay. So they vaccinated only 1 month ago, I guess.
Yes. Yes.
Burcu, can I ask related with the vaccinated?
Of course.
You are lucky if your students, all students got vaccinated. I want to ask, is this group only nursing students? All the other school group had vaccinated too?
No, please. The fortunate group is nursing students because all the healthcare professionals have received the vaccination in first go. So nursing students were fortunate, nursing and medical students were fortunate to receive vaccination in the first line, and subsequently it will go to aged people and then other vulnerable group, and then it will go to the other students, school students.
Okay, do you have enough vaccinated in India?
Yes, please. We have supplied to large number of countries vaccine from here. India has produced its own technology vaccine, and the technology which was developed from Oxford. Large quantity of vaccine has been produced and supplied all around the globe.
And one more question, please. I remember that I heard vaccinated India produced one vaccination. I'm not sure the name, but is it real, or you use the other vaccines from European countries yet?
No, please, we had two technologies of vaccine. One is Covishield. The technology came from Oxford University, but the vaccine was produced from India because India is the largest vaccine producer in the globe. Another technology, which was our own technology, Covaxin, and both are on scientific data, both are very efficacious, significantly efficacious.
Thank you, and you are really lucky than us.
Yeah.
Thank you, Suresh.
Thank you.
Teşekkürler Burcu.
Rica ederim hocam. Tüm öğrencilerin aşılandığını söylediler. Yaklaşık bir ay önce tüm öğrencileri aşılanmış. Hemşirelik öğrencileri ve tıp öğrencilerini ve yaşlıları öncelikli olarak aşılamışlar. Tabii sağlık profesyonellerini de öncelikle aşılamışlar. Sonrasında da diğer öğrencileri ve toplumun diğer üyelerini aşılayacaklarından bahsettiler. Aynı zamanda da Hindistan'da kendisi de aşı üretimi yaptığı için bu konuda da şanslı olduklarından bahsettiler. I think we have another question, Nipin Kalal.
Yes, please.
You can ask your question. I think Nipin dropped. Başka sorusu olan var mı? Do you have any questions? We don't have no other question. Thank you for your presentation. It's very fruitful to listen to you and what have you done to pandemic period. I think you are lucky too. You take all of the students to clinical placement. We didn't have that option. We have all of our clinical placement online because of the regulations, and we don't have vaccinations also. So I think you are very lucky.
Thank you very much. Thank you very much for the opportunity, and we thoroughly enjoyed. Thank you to the entire team for invitation and this opportunity.
Evet, ben sevgili Burcu'ya Jodhpur Hemşirelik Koleji hocalarından Profesör Suresh Sharma ve onun sevgili öğrencisi Kalpana Thakur'a vakit ayırıp aramıza katıldıkları ve değerli paylaşımlarından dolayı çok teşekkür ediyorum ve bugünün anısına hazırladığımız teşekkür belgelerini kendilerine ekrandan takdim ediyorum. Dear Suresh and Kalpana, thank you for joining us and sharing your valuable experiences, especially during this very special term, pandemic, COVID pandemic. And I would like to thank to our participants from your country, India. Yes, as Suresh and Kalpana mentioned, we all experience similar problems in nursing education during the pandemic period. But what is common in all countries before we get the America and Australia experiences, and we also advocated that clinical practice is a must, especially in nursing education. I want to say again, Suresh is my friend from ITPN working group, and I'm really very happy to myself to meet him and have the opportunity to work together. And I hope we can all deal with COVID completely all in a short time. And I wish you to stay safe and healthy. Thank you.
Thank you very much. Thank you.
Thank you so much, everyone. Thank you.
Ve sevgili misafirlerimiz, pandemi döneminde Dünyada Hemşirelik Eğitimi webinar serimize 26 Mart Perşembe günü Almanya örneği ile devam edeceğiz. Saat farkından dolayı webinar saati konuklarımıza göre değiştiriyoruz. Ve Almanya bağlantımız Türkiye saatiyle 3 ile 4 arasında olacaktır. Bizlerden ayrılmayın. Hepinize sağlıklı günlerde buluşmak dileğiyle saygılarımı sunuyorum.
Teşekkür ederim hocam. Thank you, Kalpana and Professor Suresh. We can end our session.
Thank you so much once again, please, and Urku for opportunity. And looking forward to visit Turkey very soon, hopefully during your conference.
We hope. And we will keep. Yeah, we will keep in touch with you, Suresh. I wish to meet with Kalpana in the future time. I'm not sure where and when, but we hope.
Sure, thank you, and I would also look for the same. And thanks to you and Professor Sharma and the Izmir University and to both of the moderators for such a lovely opportunity. Thank you.
Thank you, Kalpana. And you know you are important more than the other because you are also student and educator. So you are a new generation, young generation. So your experiences is really important for us. Thank you.
Thank you. Thank you so much.
Thank you,
Bye-bye.
please. Thank you. Bye-bye.
Bye-bye.
Bye.
Bye. Take care.
Bye. Bye.
Bye.